Anytime a child is paralyzed by polio in any country, the World Health Organization is ready to act. Even a single case triggers a full outbreak response. The World Health Organization develops guidelines and trains partners and governments so that in the event of an outbreak, everyone knows what to do. Information gathering is the first stage of any outbreak response. Experts from the country's government, the World Health Organization, and partners of the Global Polio Eradication Initiative work to answer key questions. Who is at risk? How widespread is the outbreak? What needs to be done to stop it? When a country declares an outbreak, many partners have a role to play to ensure that a round of mass vaccination takes place within just 14 days. In every affected area, detailed maps are made of the whereabouts of every single child that needs to be vaccinated. The World Health Organization works with partners like UNICEF to get vaccines into the country and make sure communities are informed about the importance of vaccination campaigns. Then every vaccine vial needs to be transported at a carefully maintained temperature along a cold chain. Once the vaccines are at their destination, the real heroes of this effort take over, the vaccinators. These heroes do whatever it takes to reach every last child, in crowded cities, remote countryside, and even populations on the move. At the same time as the vaccination campaign is carried out, surveillance is strengthened to make sure that the World Health Organization knows where every virus is at any moment in time. They find the genetic sequencing of every virus in the laboratory, gathering data to understand the patterns of the outbreak so that the response can stay one step ahead. For the virus to be stopped, at least 3 vaccination rounds are carried out. Every campaign is monitored to find where improvements are needed for next time. Every 3 months, experts come together to assess how close the country is to ending the outbreak. So long as the surveillance system is strong and enough children have been vaccinated, the outbreak can be declared closed once the country has seen 6 to 12 months without finding a polio virus. Thanks to vaccination campaigns, more than 400 million children are immunized against polio every year. Since the Global Polio Eradication Initiative began in 1988, more than 16 million people are walking who would otherwise have been paralyzed for life. This rapid response to any sign of polio relies on an incredible network of people from governments to community leaders to vaccinators on the doorstep. It is thanks to them that polio outbreaks can be stopped and future generations of children protected against this paralysing disease. Find out more about the global drive to eradicate polio at www.polioeradication.org.